One common misconception about swaddling is that it's for warmth. Sure, swaddling does warm babies, but it wouldn't really be something that we were promoting because blankets can provide warmth. What swaddling actually does is cocoon an infant similar to being in the womb because anthropologists believe that humans used to have a gestational period of 12 months. So rather than being pregnant for 9 months, they'd be pregnant for an entire year, which means the first 3 months of a baby's life are known as the fourth trimester. As humans got bigger, their heads got bigger, their brains became bigger, and we started evicting babies a lot sooner. I know this is something that's really hard to believe, but there is a lot of science to back it up. So the first 3 months of a baby's life are known as the fourth trimester, and what we should be doing during the fourth trimester is recreating the womb so that the baby feels safe, secure, warm, comforted. All of their needs are being met during their first 3 months of life. And now some people might say, well, why can't we just swaddle in a blanket? People all over the world are swaddling in blankets. And that works for babies at home when done correctly. However, a lot of parents really struggle to swaddle correctly in a blanket. They might not be swaddling with arms in the correct position. Their baby might want to be like this, or maybe have hands over heart rather than their arms, straight by their side. So a lot of parents really struggling with swaddling that way. Blankets also can become loose. No matter how tight you do a baby, if they're moving around it and they're trying to find what's comfortable for them, the blankets become loose, and what they can do is actually go up against the baby's face or up against the skin and become a SIDS risk, right? They can accidentally suffocate with the blanket over their face if they're not swaddled correctly or if they're not supervised during their sleep. But a Woombie is very different than swaddling in a blanket because of a couple of different things. One, it's patented peanut shape. So I'll show you our preemie Woombie Med Pod right here. So a lot of swaddle things are out on the market right now. There's all sorts of swaddling sacks, but nothing compares to a Woombie, and here's why. The patented peanut shape right here, what this does is allows for range of motion in the shoulders and the hips. The length of the Woombie is just long enough that baby can push up against it and have some flexion, but it can move within the swaddle so that we're not getting cold shoulders and hips, which happens a lot of times in blankets. A med pod is also different in the fact that we can keep baby cocooned and provide boundaries up against them. You'll notice a lot of people will put their baby into a bassinet or a rock and play, and there's these infant holds in it that holds the baby up against their waist or up against their shoulders to make them feel kind of snug and secure. The Woombie already does that. So if you want your baby to have arms free, possibly for holding a bottle or self-soothing at the mouth, holding a toy or something like that, but still be providing boundaries, you can use a Woombie. The Med Pod has a convertible option on it. Babies can also have tummy time, but still be feeling safe and snug and cocooned in that. In a hospital setting, swaddling is a little bit more difficult than at home or in a a home health setting because all of the medical devices that a hospitalized baby has. Even your healthiest baby that's in the hospital is going to have an IV for IV fluids or pulse ox, the Band-Aid that they wrap around the foot that measures the oxygen in the baby's blood. That's usually around the toe, and it's got a big long lead that comes sticking out of the bottom. Also, hospitalized infants going to have some EKG leads on their chest and their stomach, sometimes even their back, for heart monitoring, and those often come off when a baby is swaddled in a blanket because the leads get all kind of tangled up together in the blanket. Sometimes they stick to the blanket, they pull the leads off, and then the alarms are going beep, 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 and everybody's freaking out. But there's really no need to. It's just a simple monitor. But in a Med Pod, the peanut shape and the snugness of the fabric is very precise. It's going to hold those things up against the skin. The leads for the pulse ox and the IV, which on a baby is usually done on the foot or on the ankle, the leads can come out the bottom. If there are some leads up here at the top, the cords can be weaved through here, or they can just be weaved out the top of this zipper. And vital signs are also a lot easier to check in a Woombie Med Pod because the fabric is thin enough that a temperature can be checked, right through here. With underneath the armpit, or you can put the stethoscope up against the skin and listen to the baby's heartbeat without disturbing the baby. It was very disconcerting to me as a mother to see that every 3 or 4 hours they're coming in to check my baby's vital signs, which is standard practice to come in that often. But every time they came in, they're unwrapping my baby from the blankets. The baby is cold. They're arching. They're upset. They're screaming. They feel kind of lost in space. And as a parent, I just want to say, you know what, can't you just, slip the stethoscope in the back and listen to their heart rate then? Can't you just pull their foot out? I mean, there's got to be a gentler way to do it. Enter Woombie Med Pods. Vital signs can be checked by simply undoing the bottom zipper, pulling the foot out, checking the pulse ox, checking the ID. A heel stick can be done very easily without unswaddling the baby. In my mind, the Woombie Med Pod is really the best way to swaddle babies that are in the hospitals. We also have a trach pod that works for babies that have a port or a Broviac. We have a gastropod that has a midsection flap that opens for babies that have colostomy bags or G buttons, or maybe they just have a swollen belly and nurses can leave the flap open and just kind of walk by, check, make sure the swelling has gone down, or maybe look at the umbilical cord area a little bit, close the flap if they need to. And then we have the Billy Pod, which is a 98% luminosity swaddle. It's made out of mesh, and so babies on phototherapy can be swaddled without being disturbed. Woombie Med Pods can be found at woombie-medpods.com, or you can give us a call at 1-833-MED-PODS and find out how you can get these wonderful products into your unit. And they're not just for NICU. Even though we do have micro preemie and preemie, we also have a newborn to 3 month size, all the way up to 13 pounds. And so babies that are full term and might be in the hospital for bilirubin levels or for vent or gastro, HEMOC, anything like that, those babies can still benefit from a Woombie Med Pod. So please go to woombie-medpods.com to learn more about each of our 4 designs, and let us know if you'd like to place an order. We're happy to help you, and we can send all of our information to your vendor relations department as needed. Thank you so much.